I grew up in a very isolated area, a farm town with 400 people in it. I personally did not get to go to my yearly physicals because we just couldn't afford to get there, and the drive was over an hour away. And I got to see people that I loved and grew up with pass away early from preventative diseases that I now know were very preventative. So I'm very passionate to get into those areas that need healthcare and have a lack of resources. I usually get up around 5. I go for a run or workout usually first, and then I prepare for my day. I like to be at Barron around 7 a.m. or 7:30 a.m. My first patient's not until like 8:10, just to pre-chart all of my patients, make sure that I have all the labs in for them so they don't have to come for another visit. I make sure all the procedures that they need, I'm prepared, and the nursing staff are aware of which ones we're gonna need, so then the efficiency is much better for them and the patients are in and out much quicker. To start my day, I usually meet up with Dr. Incarlo or Dr. Scholes first thing in the morning and preparing them for any procedures I have or complicated patients or things that I need to reach out to social work for help or pharmacy for help. So then by the time the patient gets to me, everything is prepared and it's a really smooth visit for them. I typically wrap up my clinic around 5 p.m. I spend about 30 minutes just finishing notes and making sure I follow up on all the orders that I've made that day. And then I go home and I typically run, hang out with some friends, hang out at like a pottery class on Mondays I like to go to, or the yoga room on Tuesdays that I find myself at. So any type of fitness, artsy thing, or just with my friends after work. I chose the family medicine residency program in Eau Claire through Mayo Clinic because of what it offered for me. So I wanted full spectrum family medicine. When I was auditioning, interviewing, and getting the nitty-gritty about all the residency programs, this was the program that had everything that I wanted. For me, I wanted the full spectrum family medicine and I wanted to do labor and delivery, and this was like the only program in Midwest that allowed me to do that. Barron is a very small town. I think the last time I looked up, it's like a 3,500 population here, and it's a farm town. The closest like main hospital, I believe, is about an hour away from here. So very limited resources. This is like the hub for Barron, Wisconsin, and the fact that I am also working here gives access to them where they don't really have much of access. So I do get to come here at least once a month, if not more. We have such a diverse patient population. I have a huge portion of my patient population, like part of the LGBTQ community. I also get to deliver quite a few babies, so I get to retain those pediatric patients as well and have multiple generations of patients. I get my wonderful and stubborn farmers that know I'm gonna call them every year until they come to their physicals. We also all volunteer at the free clinic, so it's a completely different population in itself that have completely different needs that we get to work with here. Also, being in a rural site, there's no other residency programs and there's not a plethora of fellows. So you're one-on-one with your attending, you're the first one they call. The nurses, if they need something, you're the first one they call. If they need a procedure, you're the one doing it. If there's anything going on the floor, whether it's your patient or not, you're the one that's called to go there. So I find that you probably wouldn't see that in an urban site, is you get to do everything. All the options are there, it's just if you want it. I think working rural enhances my residency experience for the fact that I get to do everything. There's nothing that we don't do here. And the patients are wonderful and very grateful and love to be educated, and I think that really helps your baseline knowledge as well when you get to explain the pathophysiology in a way that someone who doesn't know anything about medicine can understand. So I hope to be in a rural area when I graduate residency. I also hope to be able to handle anything that walks through my door. I want a diverse patient population, and I want to make sure that the community that I'm in, whether I am the only doctor, if I have multiple doctors, that the community feels comfortable, safe, and heard when they come and see me.